Okay, let's unpack this. We are diving headfirst into one of the most frustrating chronic flaws in modern healthcare. We're talking about the patient referral process.
Uh,
You know, the mechanism that's supposed to seamlessly move a patient from their primary care provider, your PCP, to a specialist, but instead our sources show it's usually just chaos.
it really is.
Right.
We're talking missing documents, no one knowing who owns the next step,
Yeah.
just zero visibility.
And still somehow the dreaded fax
The
machine.
fax machine lives on.
So for this deep dive, we've gone through a comprehensive guide on digital referral management,
Hmm.
and our mission for you, the listener, is to give you a shortcut to really understand why the old system fails so badly,
Hmm.
how digital tech transforms it step by step, and then, crucially, where artificial intelligence is taking this. Because right now, it feels less like coordinated care and more like a high-stakes scavenger hunt.
That analogy is painfully accurate.
Yeah.
What really stands out in the material is that most of these breakdowns, they're not clinical problems. They are purely operational failures, an administrative issue that spirals into a patient health crisis. And the guide gives us this really stark way to frame it. It says, if your referral status lives in someone's inbox, you don't have visibility. You have hope.
Wow. You have hope. That's a brutal indictment of a system that's just designed to lose paperwork. So, before we get to the fix, let's really establish the pain here. Why do paper slips, faxes, and all those phone calls create such a massive burden?
Well, we can really boil it down to 4 catastrophic failure points. And it all starts with what you mentioned earlier, the complete lack of real-time visibility.
The operational black hole.
Exactly. I mean, a referral gets sent by fax or maybe a non-secure email, and it vanishes. No one knows where it is in the queue. Not the referring doctor, not the specialist's office, and definitely not the patient.
So the second that piece of paper leaves the PCP's desk, accountability just ends.
It's gone. Precisely. And that leads directly to the second point, manual handling and all the errors that come with it.
The human element.
Right. The whole system relies on someone trying to read messy handwriting or manually typing data into different separate systems. And paper records, they get lost. Faxes are notoriously unreliable. All of this lead to incomplete referrals, which forces the specialist to just delay everything.
It's not just the errors, though. It's the sheer inefficiency of how everyone has to communicate, isn't it?
Absolutely. Which is the third failure point.
Yeah.
Just wildly inefficient communication. The main way to check a status is to pick up the phone. You leave a voicemail. You wait. You call again.
You send another fax to see if they got the first one.
You're chasing faxes with faxes, and all this time, staff are just stuck on hold, not helping patients. It creates these monumental delays.
Which sounds like a perfect recipe for burnout. That has to be the final failure point.
It is the increased administrative burden. You have staff trapped in this low-value, high-stress cycle. They're just tracking down paperwork that should be automated. One estimate we saw suggests some clinic staff spend up to 40% of their day just on these tasks.
40%. That's a staggering operational cost.
A massive cost,
Yeah.
and it drains morale. It's why patients can wait weeks just to find out if they even have an appointment.
Okay, but this is where it gets really interesting. These digital referral management systems, or RMS, they turn that chaos into a clean, trackable workflow. So what are the immediate game-changing benefits of going digital?
The biggest shift is moving from that passive send and hope model to an active, traceable workflow. And the number one benefit is real-time tracking and transparency.
So everyone can see everything.
Everything. The moment a digital referral is created, it's logged, it's time-stamped. Providers get instant status updates, triaged, scheduled, completed. The entire patient journey is visible end to end. Nothing gets lost in the shuffle.
That transparency is huge, but the engine behind any good digital system has to be automation, right? How does this leverage automation?
Automation is everything here. It just eliminates those repetitive manual tasks. So, for example, automated document collection. The system will actually check that all the necessary history, all the lab work, is attached before it gets sent.
So it kills that incomplete referral loop right from the start.
Kills it. Dead.
Yeah.
And then you have automated notifications, so everyone's staff, patients, is kept in the loop without anyone having to pick up a phone.
And this solves that fragmentation problem because all the communication is forced into one place.
Exactly. It creates centralized communication.
Yeah.
The referring doc, the specialist, they can leave secure notes, ask questions right inside the platform. It's all secure. It's I2IP compliant, which is, light years ahead of a fax machine.
And all of that translates to What? Better efficiency, lower costs?
Huge efficiency gains and cost reduction.
Yeah,
Less time chasing paper means lower administrative overhead, and most importantly, patients get timely care.
that makes perfect sense. But let's walk through it for our listener. How does this actually work in practice? Let's go through the 6-step digital workflow. Starting at the very beginning, step 1, referral creation. So the PCP decides a specialist is needed. They create the referral right inside their electronic health record, their EHR. And the key here is automatic data population, right? The system just pulls everything in.
Exactly. No manual copying. It grabs the relevant patient data labs, imaging, diagnoses from the integrated systems, and instantly you have a clean, time-stamped digital record. The chance of a transcription error right at the start is, basically zero.
Okay, so a perfect package is created. Then we get to step 2, submission.
Right. And in the old world, this was the fax or the mail. High risk. In the digital workflow, it's sent via direct secure transmission through the EHR.
And that's not just an email with a PDF.
No. It's a secure, verifiable, encrypted data transfer. The specialist gets the full history instantly and securely, and both sides get an automatic notification that it was sent and received.
Okay, so it's received. Step 3 is triage and review. This feels critical for patient safety.
It's absolutely crucial. The specialist can see the entire history in one place and make an informed decision fast.
But the sources highlight something really cool here, the AI-powered urgency detection.
This is where it gets smart. The AI can automatically scan the referral for keywords, lab results, diagnostic codes, and it flags the high-priority cases, things like oncology or serious cardiac issues. It tells the specialist, look at this one first.
So the human is still making the final call, but the AI helps them prioritize their queue instantly.
Exactly. It gives them a high-confidence prediction on where to focus their attention.
So after that AI-assisted triage, we get to step 4, scheduling. And this is where we kill the phone tag.
We kill the phone tag. Once the specialist accepts, the system automates the scheduling. It can check their calendar, check patient preferences. A lot of modern systems even send a secure self-scheduling link directly to the patient so they can book their own appointment.
And then automated reminders to cut down on no-shows.
Yes. Automated confirmations of reminders via text, email, whatever the patient prefers. It dramatically reduces those costly no-shows, which are a huge headache for providers.
Okay, the appointment is set, but the system keeps tracking. Which brings us to step 5, care coordination and follow-up.
This is all about closing the loop. The system doesn't stop after the appointment is booked. It monitors the entire journey. It can send automated reminders for next steps, maybe more tests or a follow-up treatment. It makes sure no action is missed after the patient leaves the specialist's office.
Preventing people from falling through the cracks.
Precisely.
And that leads to the final step, step 6, completion and feedback.
Right. Once the care is all documented, the loop is formally closed in the system. But what's fantastic here is how that data is then used to get better.
Continuous improvement.
Yes. The system can automatically send out patient satisfaction surveys. It analyzes workflow data to find bottlenecks. Maybe it sees that the time from submission to triage is always too long for one department. That feedback loop lets the organization proactively fix their own processes.
That optimization part is key, because the real power kicks in when AI is layered on top, pushing this far beyond simple automation. Let's dig into that. How does AI add real intelligence here?
Well, we touched on triage, but AI takes prioritization much, much further. It performs what's called risk prediction.
So it's more than just flagging a scary diagnosis.
Way more.
Yeah.
It cross-references the patient's entire history against massive anonymized data sets to predict the actual trajectory of their case. It's looking at the probability of rapid deterioration. So the specialist gets this incredibly accurate picture of clinical urgency.
That saves critical clinical time, not just admin time.
Absolutely. And AI also automates another really time-consuming task, specialist matching.
Finding the right doctor for the right problem.
Exactly. Instead of someone manually searching a directory, the AI analyzes the specific need, not just cardiology, but say cardiology for a complex valve replacement.
Yeah.
And it matches the patient to the specialist who has the best track record with those specific cases and who has availability right now.
So it's using outcome data to make the perfect match instantly. And that probably reduces rejections too.
It does. And beyond that, AI is critical for just data quality. It performs data validation and quality control. It automates the data entry from the EHR, it cross-checks information, and it spots inconsistencies like missing history before the referral ever gets sent.
So the package that arrives at the specialist desk is complete and reliable from the get-go.
Every time. And then looking at the big picture, AI helps leadership plan for the future.
Through predictive analytics.
That's the strategic value. AI analyzes historical trends to predict future bottlenecks. It might see that based on local demographics, demand for orthopedic surgery is going to spike next quarter. That kind of foresight allows an organization to allocate staff and resources effectively, long before a crisis hits.
Before we wrap, I want to touch on one more detail because it's fascinating. Natural language processing, or NLP.
Oh, NLP is vital. It's what handles all the messy, unstructured human stuff. It can scan long clinical notes, dictations, even digitized handwritten forms to pull out critical information, symptoms, family history, things that might be buried in a block of text.
So it makes sure no crucial detail gets missed just because it wasn't in a neat little checkbox?
Exactly. It makes all that data accessible and useful to the system.
Okay, so let's synthesize this for you, the listener. If we step back, there are two major takeaways here. First, that visibility is mandatory, not optional. Digital RMS replaces that hope with end-to-end transparency.
And second, AI transforms these complex, time-sensitive tasks like triage and matching into truly intelligent, proactive processes. This whole shift is just essential for efficiency, for reducing that administrative burden, and for making sure that, no referral falls through the cracks. The focus finally goes back to the patient.
So what does this all mean for the future? We've talked about solving today's problems, but what's the final thought we should leave the listener with?
I think it's the shift from reactive crisis management to proactive, data-driven optimization. This system doesn't just manage referrals. It generates a blueprint for how the entire institution can improve.
So it's not just fixing a broken workflow.
Not at all. Because you can accurately forecast future demand for specialists, you gain the strategic insight to plan for staffing, for equipment, for capacity years in advance. It's that move from responding to chaos to proactively shaping the entire environment of care. That is the ultimate promise of this transformation.